Hello and welcome to Niaga Spotlight with me, Tamina Kausji. Niaga Spotlight goes through the week in economic analysis and future affairs. Now today on analysis, our spotlight is firmly on transforming obesity care in Malaysia. Just as a bit of background first though, Malaysia is certainly facing a growing obesity challenge, with more than half of adults now overweight or obese and quite often ranking among the highest rates in ASEAN. The consequences go well beyond health. Obesity-driven NCDs, non-communicable diseases, are already costing our economy billions each year in lost productivity. At the same time, obesity management is being reshaped globally by new medications that are moving rapidly into mainstream care. So these therapies, while they are showing strong clinical results, they also do require long-term supervised use, careful oversights, as well as robust systems to manage risk. Now, Malaysia's obesity and metabolic management market is projected to nearly double by 2031. The question now is not whether these medicines will play a role, but how responsibly they are going to be integrated in a way that supports economic sustainability, together with equitable access, and also, of course, long-term health outcomes. So that's the context of our entire discussion this morning. Welcoming to the studios for that, we have with us firstly Professor Dr. Rohana Abdul Ghani, President of the Malaysian Obesity Society, and Binh, who is General Manager of Commercialization for Malaysia, Singapore and Brunei with Zuellig Pharma. A very good morning to the both of you. So, to get the discussion started off straight, Binh, perhaps I could refer to you firstly looking towards system readiness as well as safety nets. Now, Malaysia, as we all know, it's a commonly known figure. We have around 54.4% of adults either overweight or obese, highest rates in ASEAN, and now the demand for these next generation obesity management medication is exploding globally. What is Zuellig noticing about the Malaysian ecosystem? Perhaps you could position us first before we really dig deep.
Sure. Hi, Tamina. Thank you for having me here today. Really a pleasure being here. So in Malaysia, weight management is sort of in a transformative stage, right?
Right.
We're seeing a lot of new, obviously, obesity medication come into the market, including GLP-1s, GIPs. And then, so it's not about traditional medicine anymore or traditional interactions. It's more about how can we provide these innovative medicines in support of that, right? So I think that's an important first to acknowledge that there is now more tools available for patients. The second thing is really important is to recognize that education is really the key to the battle, to winning the battle for obesity over the next 5 years. And education for the patients, education for HCPs, for clinicians is an important, if you will, step to combating obesity here in Malaysia. So in regards to your question around infrastructure, is Malaysia ready to tackle the obesity challenge?
That's right.
There's certainly a very strong infrastructure already in place here in Malaysia, right? Strong regulatory framework, strong process around pharmacovigilance, which is sort of being able to educate patients on the safety of different medications, strong infrastructure in terms of cold chain to ensure the medication is going to the proper place and to the patients. So I think the infrastructure is available here in Malaysia to support the battle against obesity. So at Zuellig Pharma, our goal is to work with multiple stakeholders here in Malaysia, physicians, hospitals, clinics, individuals like Prof. Rohana, to really educate patients on the correct use of obesity medication here in Malaysia. And at Zuellig Pharma, we also have a very strong infrastructure to support the safe and effective distribution of obesity medication to the right patients.
Absolutely, because clearly the obesity burden is indeed increasing. Roughly around a decade ago, it was only around 44% of Malaysians adults at least, who seem to be living with obesity, which brings us, of course, into the perfect segue to Prof. Rohana. Prof. Rohana, so I think now is the absolute right time to interject with who exactly should these obesity management medications, OMMs, sometimes they are known more popularly as GLP-1s, who should they apply to? And also, yes, let's clear up any any myths when it comes to terminology, as well as how they are publicly known to everybody, especially with the rise of social media in all of these narratives?
Right, okay, so it's a very long question to me now, but first and foremost, thank you again for giving us the opportunity to talk about obesity as a disease which is inflicting Malaysia quite, we're quite in dire straits at the moment with regards to obesity. And just to reiterate in terms of numbers, we mentioned 54.4%, over half of our adult Malaysian populations are overweight and obese.
Yes.
However, if you really look at that number, it's actually referring to the WHO criteria, which is BMI of more than 30 kilograms per meter squared for obesity.
Right.
So that itself, if I can just simplify it for you, is 1 in 5 adult Malaysians having obesity. But however, if you look at if you use the Malaysian cutoff point of BMI of 27.5 kilograms per meter squared, yes, which is our phenotype, and that would come up to approximately 36% of our adult populations are obese. So that is 1 in 3. So obviously, you know, something really alarming. So as Binh was saying, that there's medications is highly effective. It's new. It's changing the whole landscape of obesity, not just in Malaysia but globally.
Absolutely.
And we're very happy about that. But the issue really is who are supposed to be taking this medication, coming back to your question. So the indications are that BMI of more than 30 kilograms per meter squared, that's the indication, but it could be lower of 27 kilograms per meter squared with comorbidities. And these comorbidities include metabolic comorbidities, including diabetes, hypertension, hyperlipidemia, OSA, and those with fertility problems, PCOS. There's a whole range.
Cardiovascular risk.
Cardiovascular risk, because it has been proven that these medications have benefits, renal benefit, kidney benefits, as well as cardiovascular benefits, reduction of cardiovascular risk.
Right.
Risk for heart attacks and stroke. So overall, you know, that they do have their role in terms of reducing risk overall. But however, it is also also indicated in those patients who have other issues, mental issues, and who have tried to lose weight. And we haven't delved into that issue about how difficult it is to lose weight just by diet and lifestyle alone. So this is where these medications come in to be able to assist in that weight loss quite effectively. And
so there's certainly a role to be played. May I also ask Prof. Rohana, now given of course the unique obesity and related NCD burden that Malaysia has already had documented for a few decades now, and also the fact that obesity management medications, they can also be prescribed for those under 18. What are some of your thoughts around that? Would that also be perhaps another inroad for Malaysia to consider, that OMMs can also be applied clinically for children, especially adolescents 12 and above?
Yes. So you kind of like covered a very important topic there, obesity in adolescents, which is a huge big area. It's a, you know, as you know, our patients, our diabetic patients who used to be of older age now are getting younger and younger, and because they start young, then their complications are a lot more. They get heart diseases, they get kidney problems at a very young age.
It's the life cycle impact.
Yeah, exactly. So the current indications for those obesity medications are obviously quite limited. So we do have one GLP-1 treatment at the moment, which is indicated in the adolescents, and as a matter of fact, they're getting younger and younger. But again, the options are very limited. So the current GLP-1, GIP are currently not yet indicated for those adolescents. However, having said that, again, emphasizing that diet and lifestyle is still the number one, the fundamental, the foundation and the basis of obesity management throughout. So this really depends on, again, highlighting the need for recognizing first and foremost that obesity is a problem and needs to be addressed. And, you know, these adolescents need to understand that. And and of course the impact on psychological issues, on mental issues. Again, so the benefit in terms of weight loss is enormous. So, but it's just a matter of taking that first step of, you know, doing something to lose weight.
And perhaps before I jump back to asking Binh, let's talk about the fact that a majority of Malaysians who may already be using some form of obesity management medication are not necessarily consulting with clinicians before they are getting on this routine.
That's right, and because the motivations are different, so it's not for health. They have got other issues. They have got other reasons. Not to say that they're wrong reasons, but they're valid reasons. But again, this is the opportunity to highlight that any of these obesity medications are effective, but they also come with side effects and adversities. So they need
especially
to be
if
monitored.
you're not being monitored.
Yeah,
right?
exactly.
Yeah.
So then that really underscores the need for monitoring, for proper consultation, and also most importantly, these medications were not meant to produce rapid weight loss, because rapid weight loss will result in loss of lean muscle mass or loss of muscle bulk, which slows down metabolic rate, which has other health consequences. So that's one of them. And you've got other issues, especially in the young reproductive age group. So then there are undernutrition, in particular in some of these very effective drugs, they lose appetite. So they have to be advised on the proper dietary interventions for the use, with the use of GLP-1 and GIP combinations, in terms of high protein intake, ensuring adequate protein intake, adequate fiber, adequate water, yeah, so to minimize the complications.
Exactly, so it clearly points to the fact that you ought to be supervised.
Yes,
so for anyone out there as well who's
correct.
listening, that needs to be a primary consideration. Thanks, Prof. Binh, perhaps we could move into digging a little bit deeper about long-term treatment as well as rebound risk, which has been shown already a little. So tell us a little bit about the reality of patients who may not be willing to go on OMMs long-term, and what are actually perhaps some of the contraindications and also the benefits of actually long-term using such OMMs for weight management.
Right. That's a very good question. I think we have to treat obesity as a disease, right, as a chronic disease. So like any chronic disease, it requires long-term treatment. So that's the first and foremost, that's the most important aspect of obesity, right? It's not a one-time disease and resolve it and then it goes away. And so with that, I think what we like to look at is more of a multi-stakeholder support or approach to obesity, right? So you're looking at lifestyle support, you're looking at obviously working with the clinicians to provide monitoring, to ensure that the patient is really moving in the right direction for their obesity treatment. The long-term benefits of managing your obesity is, as Prof. Rohana mentioned, there's evidence around, of course, helping with cardiovascular disease, being more productive in terms of your lifestyle and also your work productivity, if you will. So I think there is a lot of evidence to prove that there is long-term benefit for obviously staying both a combination of medication and lifestyle changes. And I think that's the important aspect of obesity. So what we've launched recently at Zuellig Pharma is a campaign around My Best Me. It's a patient awareness campaign. You can go to obesity-is-a-disease-my.com website to really understand how you can manage your obesity, not just with medication, but with lifestyle changes, and also providing support groups, patient support groups, things of that nature to really help you manage that long-term approach to obesity.
Absolutely. Now, going a little deeper into the long-term approach as well, Binh. So, of course, costing is another concern when it comes to long-term management, which is why quite often, presumably, it's why people look for a short-term miracle cure, right? But of course, since we want to encourage long-term management, how should Malaysia be thinking about, let's say, reimbursement, pricing, and also employer coverage? Because clearly this is obesity as a disease is part of not just our personal and private lives, but also professional lives and the workspace too. And perhaps could this be something that we need to bring into the workspace and the work sphere too?
Yeah, 100% agree. I think there's an aspect of that we need to have a conversation both in the workspace but also as a society, right? In terms of how do we treat obesity in the long term. Of course, when centered around the pricing, or if you will, the cost of obesity medication, I would look at it in a little bit different way, if you will. And I would look at it from obviously from a reimbursement framework, how the government can support long-term care for obesity. And that's not just about the medication, that's about lifestyle changes and support groups around that. I would also look at, of course, how the employer can be a big part of that. Wellness programs, that's a big thing that's happening in corporations today around wellness programs, providing that, that
perhaps scaling that to make sure
exactly,
all corporations, all workspaces have access, right?
That's right.
Yeah.
Have mental support, patient support, things of that nature, education. That's something that obviously that the corporations can really help the patient that is obese deal with the long-term implications of it.
So what we're really talking is about the ideal interaction of all the multiple stakeholders all at once. Looking at the fair amount of maturity that the Malaysian ecosystem has for obesity care, what would you give us perhaps a potential timeline whereby we could streamline obesity management medications into this ecosystem too? It's end of 2025 now. If you were speaking very positively,
right? I think that's the $1 million question, if you will. And Prof. Rohana probably have a better take on it than I would. But I think that's something that we're going to be dealing with in Malaysia, and not just Malaysia, but across the globe for a number of years, right? I don't think any country has cracked that code, if you will, in terms of how to deal with long-term management of obesity. I really believe that Malaysia has gone in the right direction by providing both education to the patients, education to physicians, and also stakeholder management, but also having these new medications now available to patients. So I believe we're going in the right direction. When Malaysia will get there, I think that's a question that unfortunately I don't have an answer to at this point, but certainly we're going in the right direction. I don't know if Prof. Rohana
but hopefully conversations like these help to anchor us better in data and also population uptake. Prof. Rohana.
Yes. I just want to add, Tamina, if you allow me to. There is that gap, that we need to fill, and that is that knowledge gap to actually really look at obesity as a disease. And it's a progressive disease. It has complications which is not seen, they're not
necessarily visible.
Yeah, exactly. And what is very obvious, if you just take a moment to think about it, this is a great opportunity for us to be able to disseminate this awareness, if you may say that if you understand obesity is a disease, and it's very much similar to diabetes, the complications that these patients will have in the future includes heart diseases, kidney diseases, etc., right? And those things are the ones which will cost money in the future. So when people talk about how expensive these drugs or these interventions are, including surgery, it's very difficult to make people realize that this is prevention of those complications that may occur in the future. Even if they may occur, it will occur much later. So that the quality of life that patients will gain from the early intervention is, you can't even quantify that.
It's creating quality of life.
Yeah, exactly.
Literally.
Yeah.
So, Prof. Rohana, I thought we should now perhaps get a little deeper into looking at the gender disaggregated nuances of obesity management medication, women versus men. Now, in general, of course, societal structures, concerns about appearance, etc., women are the ones who are most often seeking obesity management medications. Tell us a little bit more from your working experience.
Right, you are right actually. And both my working experience as well as from literature, it has been shown that women tend to come for treatment. So the ratio is probably 2/3 versus 1/3. So most men think that they can handle it, and most men will not see it as a problem. So women, again for different reasons, they social peer pressure, so appearances, health benefits, etc. So they tend to come for treatment. But however, in terms of medication, it may actually be equal in terms of gender.
Prescription,
and it really prescription, and it really depends on which part of the globe that you are in. So perhaps in the Western side, women are probably getting more of it, but from the Asian side, men seems to have the advantage of receiving it. Perhaps it's because they are the earners, and women have other obligations, family, children, and they've got other excuses, like they've got a lot of housework to do, etc., etc. They don't come for follow-ups, etc. So again, I think it really depends on where you are, and it's very, very strongly influenced by culture. you know, so and the environment. So it's very difficult to actually pinpoint. But whatever it is, it has been proven that obesity in women is more prevalent. So, and women have a unique presentation or unique complication risks for obesity. And that's the reason why MYOS, Malaysian Obesity Society, have embarked on this program, which really highlights the obesity in women. So we've got a guideline on the on how to manage obesity in women, and we are and this program or this curriculum that we hope to disseminate among our primary care physicians, and because they are the fundamental you know, step in terms of the first contact with the community,
the stepping stone.
Yeah,
right?
yeah, exactly.
Exactly. And speaking about the fact that not just obesity care, but also OMMs are becoming increasingly well known, would you say that it would be time for a national registry to come into place, and how would that assist clinicians as well as, of course, overall multi-stakeholder understanding of the context, so we can have a far more actionable roadmap, perhaps not today, but in the very near future, right?
Yes, absolutely. And you said it all. That is exactly what we need. But this, because of the prevalence, is so high. I mean,
there are nuances to the data collection too.
Yes, that's right. So, you know, and it involves quite a substantial amount of financial support. So it has become, you know, we're working on it. We're working on it because if we have the National Diabetes Registry, so surely we can have the National Obesity Registry. But we are slow in doing that because we are currently yet to establish obesity as a disease in the country. So even to be
that
fair,
recognition.
Yeah, the recognition, because it has implications. We talk about remunerations, right? So that is probably one of the main reasons why it's a bit, all parties are a bit hesitant, because it has implications, economic, social implications on recognizing obesity as a disease. But as clinicians, that is all that we talk about. You need to be able to see this as a disease which has complications, which is even more than any of the other metabolic problems, diabetes, hypertension, hyperlipidemia.
Exactly. Naming and identifying the issue really finitely ought not to be so problematic. Thanks for that, Prof. Binh, perhaps digging a little deeper from your perspective and an industry standpoint, looking at some concrete guardrails which would be necessary to ensure that the more off-label usage of obesity management medications don't very quickly outpace those who actually require it for actual health and longevity reasons.
I think there's really, education is key in providing those guardrails, right? Education to two parties, if you will. The first is patients, making sure that they have proper awareness of the disease, proper awareness of the treatment options available to them. So we've launched recently a disease awareness campaign called My Best Me, and that allows the patient to really educate themselves on how, on what is obesity and what are the options available to. So that's one aspect of it, of ensuring there's a strong guardrail there. The second aspect is education to clinicians, prescribers, physicians, if you will. So as a healthcare service provider, Zuellig Pharma, it's our responsibility to make sure that we do proper marketing and product education to the prescribers within the label, providing very transparently the safety data, the clinical studies that are available. So making sure that we promote on label and not off label. That's very important for us as a company, so that the prescribers know and the physicians know the proper use of these new medications.
Absolutely, because clearly what's spreading quite rapidly is the exposure of the general public to what is also termed an entertainment slash publicity circles as, for example, quote-unquote Ozempic body. Celebrities and particular public figures, especially women, who have had drastic amounts of weight loss, which of course then is unfortunately quite often seen as aspirational too. So rounding out the discussion as well then, Prof. Rohana, let's talk about the broader considerations specifically for women, especially those of reproductive age, first, and perhaps also ending on the crescendo of looking at postmenopausal women too, since these also form the bulk of the age groups of women who are seeking OMMs.
Right, okay. And we had alluded to that earlier, right?
Yes, that's right.
Yeah, so, and that kind of summarizes why women are unique. You know, in the need for this obesity medication.
Right.
So for the younger population, they are seeking weight loss for those with PCOS, the polycystic ovarian syndrome, because it affects fertility.
Correct.
And you know, and these women women have struggled for years to have a child. So you know, it definitely has a place. But however, again, it has to be definitely be assisted or be as an adjunct, only as an adjunct to diet and lifestyle changes to maintain muscle mass and adequate protein intake, adequate nutrition in preparation for pregnancy. For the postmenopausal population, and again, these are women who, you know, they eat the same, they exercise the same, but just the weight just piles up, and that is because of the hormonal deficiencies that they experience. So again, so there is a role for this for these medications. So, but overall, I think at the end of the day, it's about health. So it's not, it shouldn't be about appearances. And and it's manipulated by both parties, the seeker as well as the provider.
Right.
So, you know, because there's a demand versus supply, then there is always this going to be continuous dynamics of this abuse of medications.
How do we reconcile it now that we've been able to also recognize it very early, given the unique properties of obesity as a disease condition too?
Right. So I think, again, it's not so simple. It's a very complex relationship between these two parties. So, but I think patients need to understand that the weight loss is beneficial, yes, but it should be done gradually and effectively so that you can sustain it over time, because the weight gain is real. It will come back once you stop the medications, and that's not what we want. And on the other hand, the healthcare providers should also be responsible to ensure patient safety, patient efficacy, you know, the efficacy of the weight loss, and make sure that it's sustained over time, you know, and with the understanding that you know, this is a progressive condition, and you know, really to take responsibility on to explain and to have an informed consent, to really make the patient understand what the journey is about. It's not an overnight journey, it's a lifelong journey. So, you know, I think that should be emphasized.
Yes, which also then, of course, points to the fact that properly administering the OMMs in the first place is both in the interest of the provider as well as the patient themselves.
Yes.
Thanks very much, Prof. Rohana, as well as Binh, for the most insightful conversation. Well, as Malaysia confronts our escalating obesity burden, OMMs do offer a real promise, but not a shortcut. They are powerful clinical tools that can improve health outcomes when used responsibly. And that's all we have time for today on Niaga Spotlight with me, Tamina Kausji. Here's to a productive week ahead, and we'll see you again next time.